Welcome to part one of non-parenteral medication administration. This series of PowerPoints will discuss all block 1 medication administration except parenteral or injections. We're going to start out by discussing oral medications. Oral medications are supplied to nurses in a variety of ways. The most common ways medications are supplied are in unit dose packs, blister packs, a stock supply, in an automated dispensing machine like a Pyxis, or from the patient's own medication supply. No matter how the medications are supplied to us, medications are always locked up for safety. We even go a step further for narcotics and lock those medications up in their own locked narcotics drawer. Narcotics are special because they have to be counted at the beginning and end of each shift, counted each time they're removed, and if we waste any narcotics, we must be witnessed by another RN. I'm going to break down each type of these on their own separate slides. Unit dose medications are single pills in their own container. Each container is labeled with the medication name, dose, and expiration date, and the manufacturer. Unit doses are very common and easy to use because all the information we need to do our 3 checks is right on the package. Blister packs are similar to unit doses, except instead of having 1 pill per package, there might be many pills in the package, each sealed by itself so we don't contaminate the other pills. The medication name, dose, and expiration date is written on the packaging, but because it's not an individual package, we have to either take the entire blister pack into the patient's room, which is not preferred, or we have to take the pill out of its packaging and put it into its own labeled medication cup. You won't see a lot of blister packs in acute care facilities, but long-term settings use these a lot. Stock supply is similar to how we buy our medications from the store. All of the pills are in one container, all touching each other. This method is not used in acute care, but it's used a lot in long-term care. We have to be very careful when we take pills out of this type of container so we don't contaminate all of the other pills. Just like blister packs, we don't want to take this full container into the patient's room, so we would have to remove the pill we need and put it into its own labeled medication cup. Most acute care facilities have some sort of automated medication dispensing system. The brand Pyxis is very common, but it's not used everywhere. These automated medication dispensing systems communicate with the EMR and with pharmacy and allow nurses to just receive the medication they're looking for instead of looking through every single pill out there. These machines help stop medication errors, but they're not 100% foolproof. Nurses still must follow the rights and checks of medication administration when using this machine. I will tell you from personal experience, the Pyxis has opened up, told me that this one specific medication should be in the drawer, and that's not the medication that was in that drawer. And if I didn't check my meds, I would have had a med error and given the wrong pill. Lastly, we have patient's own supply. To use patient's medication in a facility, there must be a provider order. Most facilities have a policy and procedure on how and when patients' own medications can be used, so we must follow them. Using this type of system would be similar to using stock supply. Oral medications can be administered in many ways depending on how the medication is made and how it's ordered to be given. Let's start with tablets. Tablets are what most people think of when they say pill. It's a hard pill, sometimes has a coating on it. That coating can be for a couple reasons. One type of coating is enteric coating, meaning the pill has been coated so it will not dissolve in the stomach, but will dissolve in the small intestines. There are many reasons why medications are coated this way, but it's usually to prevent stomach discomfort or to prevent the stomach acid from degrading the medication before it can be absorbed. Sometimes the coating could be to make the medication absorb over a specific amount of time or delay the absorption. We call this extended release, and there are many types of extended release. We can have ER standing for extended release, SL for slow release. We can have CR for controlled release, DR for delayed release, and many more. One thing to know is if a tablet has a coating, we cannot crush or cut the pill. We also have capsules, which are softer, almost plastic-like, that can sometimes be opened so we can pour out the contents. Some capsules can have extended release properties to them, so you really need to know when you're looking at your medications. Next, we have powders, which usually need to be mixed with some sort of liquid and drank. Some medications are already in liquid form, ready to be drank, and some medications need to be dissolved under the tongue or in the cheek. If we have a patient who has difficulty swallowing pills, we have some options for them. The first option would be to ask pharmacy or the provider for another route, or if the medication comes in a liquid or powdered form. Not all medications come in another form, so many times we have to work with what we have. If the pill is able to be split or crushed, we can cut the pill in half to make it smaller or crush it up into a powder and give it with some pudding or applesauce. Before we do this, we need to make sure the pill can be cut or crushed. Remember, anything that is coated, like enteric or extended releases, cannot be cut or crushed. If you're in doubt, check your drug guide or call your pharmacy. There are other ways we can give non-parenteral, non-oral medication. Transdermal is usually administered by a patch that's placed on the skin. Topical is usually rubbed onto the skin or a specific body part. Rectal medications are administered into the rectal vault. Vaginal medications are instilled into the vaginal cavity. Inhaled medications are inhaled and absorbed through the lungs. Ophthalmic medications are usually eye drops or ointment instilled into the eye. And otic medications are usually drops that are instilled into the external ear canal. I want you to self-study these medication types, except for inhaled medications. We're going to discuss those on the next couple of slides. When we give inhaled medications, there are some rules we need to follow. First, we want to give any bronchodilators first. We do this to open up all of the airways to allow for maximum absorption of medications. If the patient has to take more than one puff of their inhaler, wait 1 minute in between puffs. If the patient has more than one inhaler, we're going to wait 5 minutes in between each drug or as recommended by the manufacturer. When we're finished, we're going to have the patient rinse out their mouth and we're going to rinse the mouthpiece of that inhaler. And then to administer the medications, there are 3 ways that we can do so. The preferred method for inhalers is to use a spacer as directed by the manufacturers. Spacers allow for full inhalation of the medication and are much easier to use. The second method would be to not use a spacer and have the patient activate the inhaler about 2 finger breaths away from their mouth and slowly take a deep breath in. This method requires the patient to time their puffs and their breaths, which can be difficult. It also allows the medication to dissipate in the air, which means some of the medication will be lost. The most common method you will see is also the least optimal method. This is when the patient puts the mouthpiece directly into their mouth and activates the puff right into their mouth. This can cause the medication to stick to the lining of the mouth and not actually be inhaled. And if your patient's taking a corticosteroid inhaler, they will actually cause the steroids to sit in the mouth and tongue, and then they can develop yeast infection in their mouth called thrush, and it's incredibly painful. We also have dry powdered inhalers that work very differently from other inhalers. They don't actually require a puff, but instead the piece of equipment uses the force of the patient's inhalation to release the powder. And I want you to follow manufacturer's instructions for use on those. And this is the end of non-parenteral medications.